Hi, my name is Mallory Wilson, and my proposal was on postpartum care for justice-involved women. Um, the reason why this is a topic that's important to me is something because I think it's a topic that really needs to be researched more in depth. So that's kind of why I just picked this one. In my introduction section, I talk about what my hypothesis is, which is that my hypothesis is that if we were able to identify which therapeutic modalities would work best for women that have postpartum depression or postpartum anxiety, I feel that it would minimize the potential for them to reoffend and end up back in the criminal justice system as a long-term solution. So this could be different things like EMDR, the systems, methods, trauma-informed counseling, all those different pieces. And of course, with my proposal, I was unable to do the actual data collection. But if I did this as an actual dissertation, I would definitely do that. I would actually go and try to get the data collection for it, because that would be a big piece of this, would be getting that information. So in the first part of my introduction, I pulled from a couple of different resources. One of the articles talked about substance use specifically. So it talks about how substance use disorders and recovery really can impact women when they're in that perinatal period. So in this particular article that I had identified and found and used talks about how those things can impact people. It talks about what factors can influence that substance use and the recovery piece during this time as well, and what things can impact those outcomes for these mental health disorders as well. Then I have an article that I talk about in this introduction section that I found that addresses attachment security and separation. So when we look at women that have had babies, there are a lot of women that are pregnant when they go into the system, when they're in prison or in jail, and they have a pretty drastic separation period that they go through when those babies are then removed from their care because of, they're still incarcerated and those types of things. And then, so this particular piece of literature talks about those experiences of these women and, how that impacts their ability to be able to navigate mental health, and how that do have some pretty drastic implications for things like postpartum depression and postpartum anxiety, other types of mental health conditions as well. Kind of going forward, and then my third piece of literature that I talk about in my introduction is an article that I found that addresses correctional care standards. It was written by an actual doctor, and in the article she really goes through and talks about what these standards of care should be, regardless of the fact that these are individuals that are in the correctional care system. And she just kind of goes through and breaks down what those expectations should be as people are in these settings. And it's really interesting to read that particular piece of literature, because I've never really seen a piece of literature like that where it really did address all those different pieces as well. So that was kind of my introduction. Let's see. And then if we go into my methods section, so if I was to do this as a dissertation piece, I would really try to get about 500 women, hopefully, I mean, that might be a little much, depending on how long it was taking me to do the data collection, but 500 would be kind of the best case scenario. If I couldn't get 500, then I would really be more looking at, things like maybe like 100 to 200. And I would pull these participants from women's state prisons nearby. So we have 1 to 2 state prisons here in Idaho, and then there is, I would probably try to do maybe 1 in Washington, maybe Oregon, and kind of, get a good range of demographics, and as far as, in the Pacific Northwest goes. And what my goal would be is to be able to go into these facilities and with like surveys and these different tools to be able to, and I would do it in groups. So I would do groups of 5 to 10 women, kind of explain the purpose of why I'm there and what I'm hoping to gain from them doing these surveys and utilizing these tools that I presented as well. So that way it would bring more knowledge to my study, and I could really get some good data collection to be able to compare numbers and really get a better understanding of what has been done in these settings for women with postpartum depression or anxiety, and then how this could play into some better care kind of going forward as well. So that's kind of what I would do for my methods piece as well. 1 second here. Let's see. And then for my last part of this, the analysis, I would really want to kind of get all this information gathered after I was able to get, meet with all these women and these different correctional institutions and really utilize all that information. So I would be using both the Edinburgh postnatal depression screening and also the postnatal specific anxiety scale would be the 2 biggest pieces that I would use as part of my analysis as well. So that way I could get a really good understanding of what their experiences have been and what we could better address for them kind of going forward, and what could be the better way to address these mental health conditions. I would probably need to use the ANOVA to really test my hypothesis as I do my analysis, just because that does allow me to utilize 3 or more different variables, because a lot of these women, they're going to have variables of different things in their life going on, like, how long they've been incarcerated, what their childhood was like, their background, what led them to incarceration, and then, what their experience has been while they were pregnant, whether they were pregnant while they were in prison or not, and then, what that separation looked like for them and their baby, and how all of that plays into what their experience is currently. So that is my proposal. It is something that I feel extremely strong about, and that if I do get to a point where I am able to go for a PhD after I do my master's, which I'm starting next year, I would like to actually do a dissertation on this specifically. So thank you for listening, and have a great rest of your day.